All right, today we're going to be going over neuropharmacology and mobility for pharmacology, obviously. All right, so tell me, the autonomic. All right, autonomic nervous system. What that is. So tell me some of the things that the sympathetic nervous system does. Dilates pupils, bronchodilates, inhibits saliva production, raises heart rate and blood pressure, decreases GI motility, and relaxes bladder. What are the adrenergic receptors of the sympathetic division? Alpha 1, alpha 2, beta 1, beta 2, beta 3. What are the what are the neurotransmitters for the adrenergic receptors of the sympathetic nervous system? Norepinephrine, epinephrine, and dopamine. Tell me some of the things that the parasympathetic division does. Constricts pupils, bronchoconstriction, increases saliva production, lowers heart rate and blood pressure, increases GI motility, and contracts bladder. What are the cholinergic receptors of the parasympathetic division? Nicotinic, which is nerve and muscle, and muscarinic, which is organ. What are the neurotransmitters for cholinergic receptors of the parasympathetic division? Acetylcholine. What does acetylcholine do? Excitatory and stimulates movement. What does dopamine do? Balances acetylcholine and controls movement. Alright, so we got pyridostigmine, which is intermediate acting, and we got idrophonium or tensilon, which is short acting for diagnosis. Alright, what is pyridostigmine or tensilon used for? Myasthenia gravis, like muscle weakness, fatigue, and ptosis. What is pyridostigmine's mechanism of action? Prevents ACH destruction. What are the side effects of pyridostigmine? Muscle weakness, dyspnea, dysphagia, abdominal cramping, drooling, tearing, sweating, and bradycardia. What are the possible risks of pyridostigmine? Myasthenic crisis if underdosed, cholinergic crisis if overdosed, breathing problems, and suffocation. What do we got to educate the patient on when using pyridostigmine? Wear ID. What are the considerations for administration of pyridostigmine? Take on time, take before meals, make sure they can sip water because dysphagia is a possible problem, have atropine for cholinergic crisis, not curable, treatment is lifelong. Alright, Carbidopa and Levodopa, what is that used for? Parkinson's. What is the mechanism of action of Carbidopa and Levodopa? Converts to dopamine. What are the significant side effects of Carbidopa and Levodopa? Normal movements, nausea, fatigue, insomnia, dry mouth, blurred vision, orthostatic hypotension, and urinary risk. What are the possible risks of someone taking Carbidopa and Levodopa? Cardiac problems, orthostatic hypotension, may increase the effects of malignant melanoma. What do we need to educate the patient on when taking Carbidopa and Levodopa? Avoid vitamin B6, alcohol, and CNS depressants, and do not abruptly discontinue. What are the considerations for administration when taking carbidopa or levodopa? Take with low protein food. What are the indications for baclofen? Multiple sclerosis. What is the baclofen's mechanism of action? Blocks nerves to release muscles. What are the significant side effects of baclofen? CNS depression, drowsiness, dizziness, headache, vomiting, diarrhea, urinary retention. What are the possible risks when taking baclofen? Liver damage. What do we need to educate the patient on when taking baclofen? Avoid alcohol and depressants. Avoid driving. Prescribed for no longer than 3 weeks. Decrease slowly to avoid rebound spasms. What are the considerations for administration when taking baclofen? Take with food. What is Myasthenia Gravis? Inadequate secretion of ACH. Why are we losing ACH with Myasthenia Gravis? Because there's an increase in acetylcholinesterase, like no low nerve impulse and muscle response minor jumps. What are the main side effects of Myasthenia Gravis? Muscle weakness, fatigue, and ptosis. What are you at risk for with Myasthenia Gravis? Respiratory muscle paralysis, difficulty chewing and swallowing. So the meds are acetylcholinesterase inhibitors. So how do we know if we have a cholinergic crisis? They're overdosed. How do we know we have a myasthenic crisis? They are underdosed. What are the side effects of cholinergic and myasthenic crisis? Muscle weakness, dyspnea, dysphagia, abdominal cramping, drooling, tearing, sweating, and bradycardia. What is Parkinson's disease? Chronic neurologic disorder and imbalance of dopamine and ACH. Usually have low levels of dopamine. What are the symptoms of Parkinson's disease? Rigidity, bradykinesia, postural changes, lack of facial expression, pill rolling motion of hands. You can read this if you want. They both increase effects of okay. And this too. Brown discoloration of urine and sweat is normal apparently. Okay. What is multiple sclerosis? Autoimmune disorder, where immune system attacks the myelin sheath of nerves in the brain and spinal cord and causes lesions and plaques. What are the common characteristics of multiple sclerosis? Remissions and exacerbation, generalized weakness, muscle spasticity in extremities, and diplopia. All right. What is osteoporosis? Lose too much bone, make too little bone, or both? All right. Vitamin D ends in OL. They help with osteoporosis. And watch out for hypercalcemia is greater than 10 milligrams per deciliter. Biphosphonates stop or slow bone resorption, generally end in 8. Biphosphonates are given oral and IV. Then Alendronate. How do we give Alendronate orally? Take in the morning, sitting upright with a glass of water, not eating anything for 30 minutes after administering med. Basically do that. And then if bone density increases, staying the same, treatment is successful. What is calcium carbonate used for? Treats mild hypocalcemia, but if you have too much, you can get vascular damage and kidney stones. And chronic, high doses are 3 to 4 grams a day. All right, so with calcium carbonate, take with a large glass of water during and after a meal to increase absorption. And calcium carbonate interacts with tetracycline, thyroid hormone, thiazide diuretics, and loop diuretics. And you can read these if you want. I think we have these on different thing.